the causes of stridor, and given that that's the case, there can be problems with misdiagnosis and missed diagnoses because of that assumption. The other typical time that an infant going into childhood will get stridor is when they have an infective condition, which is a viral condition that affects just below the level of the vocal cords within the voice box, and that is what we call Croup. And the treatment and management of that's very different. That child's sick and unwell all of a sudden. So the Laryngomalacia, they're not sick, they're not unwell, but they develop this squeaky breathing noise. And it's usually most evident when they're active,